Hi, and welcome to this Friday's 5-minute consult with your favorite family medicine doc. In these videos, I discuss everything that you need to know about some of the most common health conditions listed from A to Z, and today's topic starts with the letter J. So let's talk about joint pain. What is it? Joint pain falls under the category of arthritis, and arthritis is a very broad term that actually covers over 100 diseases. There are several types of arthritis that can lead to joint pain, and it can affect your joints both large or small, including your hips, knees, finger joints, hand bones, or even the joints within your feet. About 1 in 5 adults has some form of joint pain or arthritis, and it is more common as you age. What is the cause? Like we talked about, age can be one cause of arthritis or joint pain because as you get older, your joints tend to wear down. Gender can also be a notable cause as joint pain tends to occur more often in women, but there is one form of joint pain or arthritis that occurs more in men, and that is gout. Sometimes our body's genes play a role in the formation of joint pain, as there are certain diseases linked to genes, including rheumatoid arthritis, lupus, and ankylosing spondylitis. Being overweight can lead to a specific form of arthritis called osteoarthritis, particularly in the knees, because carrying extra pounds can actually lead to arthritis in the knee and cause it to get worse faster. Another cause of joint pain or arthritis can be an old injury that you may have had. This can lead to excessive scar formation and therefore the development of arthritis in the joint that was injured. Another cause would be infection. Certain bacteria, viruses, or even fungus can infect joints and lead to inflammation and therefore cause joint pain. And lastly, even the type of work that you do can lead to joint pain. For instance, if you have a job that has a lot of repetitive motion, that can lead to pain in your joints over time and put you at more risk for osteoarthritis. What are the symptoms? The symptoms of arthritis or joint pain are obviously that you will have pain in your joints, and this can be only with movement or also at rest. It may affect only one larger joint, or it can affect a lot of smaller joints as well. Other symptoms may include a lot of swelling, stiffness, even redness around the joint area, a lot of tenderness, trouble moving your joints, or having problems with everyday simple tasks. These symptoms can be constant, or they can come and go, and they can range in severity from mild to moderate to severe. When it comes to arthritis, there are actually many types, but the two that you may have heard of the most include osteoarthritis and rheumatoid arthritis. Osteoarthritis is when the cartilage or the cushion on the ends of your bone wears down over time and leads to rubbing of the bones, and that leads to pain. It occurs more with age, but it can also occur faster if you have had an injury to a certain joint. Rheumatoid arthritis is slightly different as it is caused by an autoimmune disease, and that's where your body's immune system attacks its own tissues. In this case, there is an attack on the tissues surrounding your bones, cartilage, and joints. Rheumatoid arthritis can affect all joints, including the feet, knees, elbows, shoulders, but it also more commonly tends to affect the hand joints and the fingers, leading to some outward deformities that are fairly classic for rheumatoid arthritis. Because it is an autoimmune disorder, you may also develop other symptoms, including inflammation of your lungs, nodules underneath the skin, fatigue, fever, or weight loss. Gout is another form of arthritis or joint pain, and I did a video all about gout, so be sure to check that one out to learn more about it. And other forms of arthritis that lead to joint pain that are worth mentioning include ankylosing spondylitis, which is a form of arthritis that affects your spine, lupus, which is another type of autoimmune disease that affects your skin and your joints, and psoriatic arthritis, which starts out as a skin condition but then can lead to arthritis of the joints as well. When to see your doctor? The average adult has the occasional muscle ache or joint pain from time to time. However, if you are experiencing joint pain that is excessive and not going away, you will want to see your doctor, especially if your symptoms are worsening quickly, or you have relatives who may have autoimmune disorders and you are concerned about an autoimmune disorder causing your arthritis or joint pain as well. Your doctor will be able to perform certain tests to find out the cause of your joint pain and see if it is due to one of these forms of arthritis, which brings us to diagnosis. If you are concerned about an issue with ongoing joint pain, you can see your primary care doctor. They are going to ask you questions about your joint pain as well as take a family history to see if any autoimmune disorders such as lupus or rheumatoid arthritis run in the family. On physical exam, they are going to examine the affected joint, check for range of motion, check for any warmth, redness, or swelling, and rule out any infection. If there is concern for infection or the joint has a lot of fluid built up around it, they may take a sample of the fluid around the joint and send it for testing. And finally, your doctor may order a diagnostic imaging study for you to rule out the cause of your joint pain, and this would include starting with the most basic form of imaging, which includes an X-ray, as well as maybe an ultrasound, and if needed, they can also order an MRI to look further at your joints. What is the treatment? The specific treatment for your joint pain may depend on the type of arthritis that you have, but overall there is a broad range of options, including medications, physical therapy, sometimes splints are used for certain joints. Weight loss can be a form of treatment as well, and in rare cases, sometimes surgery. As far as medication for treatment of your joint pain, there are many different types of medications you can use, and these can include pain medications. There are both over-the-counter and prescription forms. The over-the-counter forms may include Tylenol or Advil. They also make specific forms for arthritis that you can get at your local store. If over-the-counter medications are not working for you and your pain is more severe, then you can talk to your doctor about a prescription pain medication for your joint pain. This can also include anti-inflammatory medication, including a steroid. If your joint pain is due to one of those autoimmune disorders that we talked about, including lupus or rheumatoid arthritis, your doctor is going to place you on specific medications to treat that disease. These medications include a specific type known as biologicals, which work to counteract the inflammatory process of the disease by using a specifically genetically modified bacteria. And the other medication is known as DMARDs, which stands for disease-modifying anti-rheumatic drugs. Now let's talk about prevention. In the case of rheumatoid arthritis, you may not be able to prevent that disease as it is an autoimmune disorder. However, for many of the other types of arthritis that lead to joint pain, you can educate yourself on the cause and prevention of these diseases. For instance, if you are one who is prone to gout, you can learn all about gout and certain foods to avoid to prevent future gout attacks. Check out my recent gout video to find out more. Other ways to keep your joints healthy and pain-free may include trying to avoid any excessive injury to your joints, trying to get some daily exercise so that your joints can be freely moving but don't overdo it to hurt your joints. This exercise can also keep you at a healthy weight so that you don't have extra pounds to carry around and hurt your joints in that way. And lastly, if you do have an injury to a joint or you start to develop joint pain, seek treatment right away so that you can prevent future development of arthritis and joint pain. And that wraps up our discussion today on joint pain, including arthritis and the many types. If you have any further questions, please let me know in the comments section. I would be happy to answer those for you. If you would like to see more educational videos like these, be sure to subscribe as I am releasing new videos every Friday. And I will see you on the next video. Until next time, bye!